The new legal changes on bleaching are certainly very welcome, and it provides a lot of clarity where previously dentists were worried about staying legal. The grey areas at the moment are really around in-surgery whitening, which I'm not so upset about actually, because the situations where you would consider going over 6% hydrogen peroxide, where you're treating what could be defined as disease, so very chromatic dentin, tetracycline stain, those sort of situations, those patients are probably the worst candidates for in-surgery treatment anyway. And we all really know that in that scenario, the home treatment is going to be, A, now perfectly legal, and B, a lot more effective. The real problem that we have with the new legislation is regarding treatment of people under the age of 18. The problem, the scenario that you could perhaps imagine, a patient who's 14, 15 years old, has some trauma on one of their front teeth, the tooth is dead, it's been root filled, and it remains dark. And of course, at that time in their lives, teenagers are very, very self-conscious, and a dark tooth in the middle of their smile really is not a good thing psychologically for them. The current legal situation makes it very clear that cosmetic treatment with bleaching for under 18s is not legal. But there's absolutely no way that placing a crown or a veneer on that tooth makes any sense, because no matter who does it, it will need to be replaced, maybe let's be generous and say 15, 20 years later, and the patient who starts off at the age of 15 will go through so many cycles of restoration between that time and when they die. Of course, that's legal. Bleaching the tooth, by some people's interpretation, isn't. But I think we need to remind ourselves that the changes in the law relate purely to cosmetic treatment of teeth, which is the most common scenario where you're going to be doing some whitening. It doesn't apply to the treatment of disease. So for under 18-year-old patients, it is probably still legal. Now this is my opinion, which has not been tested in court, but my opinion would be that we are treating disease, we are acting in our patients' best interests, and there's no planet on which it's sensible to start putting aggressive indirect restorations on young patients' teeth just to stay on the right side of the law. Nor do I think it's reasonable to say, go away till you're 18. So we live in interesting times. New changes bring new solutions and new problems, but we live in interesting times.